Goodbye to carefree long summer days. COVID-19 cases are climbing in Germany and beyond. The attempt to return to normalcy has thwarted social distancing measures, and now Germany's Center for Disease Control has a warning.
The latest developments in view of the number of COVID-19 cases is worrying for me and everyone at the Robert Koch Institute.
Authorities fear holidaymakers will bring the virus with them, so there are now tests at airports to help curb that risk. No one wants a second wave of the coronavirus or another wave of lockdowns, but no one can rule them out if the number of cases continues to rise. Welcome to your COVID-19 special here on DW News. I'm Monica Jones in Berlin. As always, good to have you with us. Now, normally, virus infections like the flu thrive in the cold of winter, but SARS-CoV-2 is different. This virus seems to actually enjoy the summer season. Is the second wave perhaps closer than we think?
A deck chair every 2 meters, sunbathing and social distancing. The beaches in southern Spain are giving COVID-19 infection only the slimmest of chances. Catalonia is something else. Young Spaniards party on the beach. Now they're faced with fines of up to 15,000 euros. Today, a botellada, a party, is not a party, it's an act of insolidarity. Those who get infected out partying will carry the virus home to their families. It's common knowledge. Spain has been one of Europe's hardest hit countries in the corona pandemic. It took months for the country to bring the virus under control, and now it's on the rise again. Right now in Spain, we have a higher incidence than 3 or 4 weeks ago. That's clear. It cannot be hidden because all the data is given with all possible transparency. Now, many European countries are warning against taking holidays in northern Spain. In the UK, people returning from Spain are forced to go into 2 weeks quarantine.
We can see that there's a second wave that's coming across Europe, and there's parts of Europe where we can see the number of cases rising sharply. We want to prevent that from happening here, and so we're prepared to take action, sometimes quite quickly, as we had to, sadly, with people who are in Spain in terms of quarantine.
In France, too, anxiety over a second wave is rising. Infection numbers are on the way up here, too, though not as sharply as in Spain. The government is concerned nonetheless. Look around us. In Catalonia 10 days ago, you would have said that there was not going to be a second wave, but now Catalonia is in difficulty. This is also the case for certain English towns. It's the case in Belgium and in Germany in certain German territories. So we see that there's a virus emergency that must be avoided at all costs, so we don't end up with a new pandemic. One of Europe's new virus hotspots, the Belgian city of Antwerp. In the last few days, more than 500 new infections have been detected. Authorities have now introduced a curfew between 11:30 at night and 6 o'clock in the morning. If numbers continue to rise, the city will go into lockdown. Antwerp is doing everything it can to stop the second wave.
And for more, I'm joined by Tobias Kurt. He's Professor of Public Health and Epidemiology, and he's the Director of the Institute of Public Health at the Charité Hospital here in Berlin. Good to have you with us. So clearly, case numbers are rising again. Is this already the much talked about second wave?
It's correct that the numbers are rising over the last couple of days. Whether this is the start of the so-called second wave is unclear. It could be, but we can also hope that the numbers are declining over the next days. So it's a little bit too early to talk about a second wave.
Well, it's good to hear an epidemiologist mentioning the word hope. We all obviously hope that things are getting better. But when we talk about this second wave, what exactly is it? How do you define a second wave?
Well, I think there is no clear definition of a wave. So pretty much you see a wave when you plot the rates of infection over time. So clearly there was a first wave and then the numbers were declining. So now the numbers are rising again. Whether this is then in the end a wave can only be seen retrospectively. So when we look back, we see that there was a second wave. And it's always difficult in the beginning to say whether this is the start of a second wave or if the numbers are actually going down again in the next days.
Of course. I mean, we've had pandemics before, and there are studies, and there were studies made also about, like, the Spanish flu. There is a fairly recent study, the so-called CDRAP report, and that hypothesizes 3 possible scenarios for second wave. We see here the first one, peaks and valleys. After the first spike, there's a series of smaller recurring waves every few months for the next couple of years. The second scenario is called fall peak. So there's a fall during the summer season, but COVID-19 would then come back with a vengeance in autumn and winter, with smaller spikes continuing well into 2021. And finally, the third scenario is called slow burn. So there would be no second wave. And even though the virus is still here, it could be kept under control. I think I like the third scenario best, but obviously I can't choose. From what we know and from what we observe, which one of these is the most likely scenario for COVID-19?
What one has to understand is that these are all hypothetical scenarios. And if you go back in February and March, when these projection models have been proposed first, many of those were incorrect. So now we have several scenarios that are plausible, but which one is the most likely is difficult to say. I also hope for the third one, obviously, that we all are able to control the spread of the virus and the rate of infection, but it's very difficult to say. And also, if we do have medication or vaccination available, that will certainly also change the development of these curves. Important is that we are prepared for each of these scenarios so that we have a plan what if one of these scenarios appears to be the most likely one. And that's something we have to judge daily, as the COVID-19 pandemic is a very dynamic situation. So it's very difficult to say which one of these is right, and we all can help to achieve that the third one is the most likely scenario.
Could there be a fourth or fifth scenario? I mean, SARS-CoV-2 has been surprising in many ways before, so could there be something completely different happening?
Yes, there could be something completely different happening that we don't expect, and several things have been completely new. So while you're right, so we had pandemics before, but each pandemic has their specialty, so to say, and so yes, there could be something completely different.
All right, well then let's hope that we'll be prepared for whatever comes along. Professor Tobias Kurt from Berlin Charité, thank you so much for your time and your expertise, and do stay healthy.
Thank you for having me.
Well, time for more of your questions now, and it's over to our science correspondent, Derek Williams.
Could immunosuppressive measures help prevent serious cases from becoming critical?
Many of the deaths caused by COVID-19 aren't due directly to the infection, but instead to an immune response that goes berserk and starts also attacking the body's healthy tissues. Since the start of this pandemic, doctors have gotten a lot better at treating that aspect of the disease, but physicians have to walk a tightrope when it comes to suppressing the immune system. If they do it too early, the virus has the opportunity to retrench. If they do it too late, it could be too late to save the patient's life. That's why, for example, the immunosuppressant dexamethasone is helping people survive in late-stage critical disease, but is not recommended for less severe cases because in them, it can do more harm than good. A new study has indicated that a yardstick for measuring when to administer dexamethasone or other immunosuppressant drugs might be levels of a certain protein that's produced in the liver in response to inflammation. But those findings still have yet to be confirmed.
What about Cambodia's research on mosquito saliva? Could it help against COVID-19?
I have to admit that I decided to answer this question just because it caught my eye. I thought, could researchers really be looking into mosquito spit in connection with COVID-19? Well, not directly, but we live in an age of pandemics, so it's really still pertinent to talk about it if we want to look down the road to the next potentially dangerous pathogen, which unlike SARS-CoV-2, might easily be transmitted by mosquitoes, like the Zika virus was, for example. It turns out the saliva that a mosquito injects when it bites you doesn't just have a numbing effect, and it doesn't just contain an anti-clotting agent that keeps the blood flowing and transmitting pathogens straight to your bloodstream. That saliva also seems to give those pathogens a helping hand in sneaking past your immune system in an early critical phase of the infection. So what the work in Cambodia is looking at is using proteins found in the insect saliva to create a kind of universal vaccine against all of the diseases carried by mosquitoes, because your immune system would react fast when it detects mosquito spit. It's super, super interesting research, and the early results look promising, but though it might help one day against a disease that's transmitted this way, like the Zika virus, I don't see it having any direct benefit in COVID-19 research.
And that brings us to the end of this program. Just one more thing ahead of the weekend. Why not spare a thought for the circus industry in these trying times? Now, Hamburg's 200-year-old Circus Kaiser was booked out until 2022, but then came the coronavirus. Physical distancing means less space for an audience and less ticket sales. But the show must go on. Well, let's hope the circus won't have to close the curtain for good. We all need a bit of entertainment now more than ever.